and welcome to In Depth. I'm Tina Jha. India is gradually succeeding in providing basic needs to its citizens, from safe drinking water to food security, cooking gas, universal access to health for all, sanitation and education. The transformation has been rapid in the last 4 years. Today, all inhabited villages in the country have access to electricity. More than 5 crore people have been given new cooking gas connections within a span of just 28 months. And in the last 4 years, there's been a 14% increase in the number of households having toilets. Further, the recent UN-led Multidimensional Poverty Index showed that 271 million Indians moved out of poverty between 2005-06 and 2015-16, with the country's poverty rate falling from 55% to 28%. Today's In Depth talks about this rapid transformation in the living conditions of Indians and how fast rural India is catching up with urban India. The last 4 years in particular have brought about a qualitative change in living conditions of people. By formulating people-friendly policies, the NDA government has worked towards easing living conditions of citizens, transforming their lives in countless ways. In this report, let's see the progress that India has made in various sectors. The Economic Advisory Council to the Prime Minister commissioned a study that indicates significant progress in how India has addressed the basic needs of living like electricity, tap water and cooking gas for its people. In April this year, India achieved a major milestone in the country's journey towards universal electricity access. Manipur's Laizang village became the last non-electrified inhabited village to join India's mainline supply network. Now all 5,97,464 inhabited villages in the country have access to power. This means nearly 89% or 26.3 crore of the country's households have access to electricity. All remaining households in the country are expected to get electricity by 2020. However, the rural-urban divide remains. 1 out of 6 village households are still without electricity, compared to as much as 99% coverage for urban households. Power supply is a huge issue, especially in the summer season when there is more demand. During peak summer, power availability is restricted to about 18 hours, while in non-summer months, it is slightly more than 19 hours. The least developed rural district gets only about 14 hours of electricity during peak summer, compared to about 17 hours for its urban counterpart. In 2001, the number of households with LPG connections was 3.5 crore. A significant population, both urban and rural, used firewood and cow dung cakes for cooking. Smoke from the traditional biomass not only had adverse health effects but also caused air pollution. Now, in 2018, there are 19.8 crore households with cooking gas connections. This translates to 67% households in the country having access to cooking fuel. Between 2014 and 2018, there was a 27% increase in LPG coverage as against a 12% growth between 2011 to 2014. While 90% of urban households now have cooking gas, only 59% of the rural ones enjoy the facility. India is one of the most improved nations for reaching more people with safe water by numbers since the year 2000 and ranks second only to China. India reached 300 million new inhabitants with safe water. In 2011, only 3 states had more than 70% households with access to tap water. By 2018, their number had increased to 15. In the last 4 years, tap water connections have gone up by 26% against only 12% during 2011 to 2014. Particularly in rural India, growth of households with tap water increased at a much faster pace. Between 2014 to 2018, 28% rural households got new tap water connections compared to 22% households in urban India. Despite the efforts, only 19.3 crore households have access to tap water. Rural areas are the most deprived when it comes to tap water, with only 11% to 21% households with access to tap water, whereas in the least developed urban clusters, more than 60% households have water connections. In addition to electricity, cooking gas and water, India is getting empowered by digital revolution. The Bharat that outnumbers India 4:1 is at the helm of digital transformation. According to a report on The Economist, 3 people in India experience the internet for the first time every second. Most of these newcomers are rural smartphone users who have never used a computer. India has become the world's largest consumer of mobile internet bandwidth, growing tenfold from last year. Further, with more than 1 billion users on the Jan Dhan Aadhaar mobile trinity and the increasing adoption of open access and inclusive technologies, the unseen majority of Bharat is soon expected to join the economic mainstream, creating vast opportunities for innovative entrepreneurs. With this grassroots transformation, the pace of growth for Bharat over the next decade is expected to far exceed what has been achieved over the past 4 decades. Bureau Report, Rajya Sabha TV. In the past decade, over 270 million people have moved out of poverty in India, according to a UN report. More global and Indian surveys have also shown that India has made far-reaching progress in poverty alleviation. In fact, earlier this year, India also shared the distinction of being the nation with the largest number of poor people in the world.
The number of poor in India has reduced by half between 2005 and 2015, according to a United Nations report. The recent UN-led Global Multidimensional Poverty Index for 2018 shows a promising future for the poor in India. The index says that over 270 million people in India moved out of poverty between 2005-2006 and 2015-2016. The poverty rate in the country nearly halved from 55% to 28% over the 10-year period. India is the first country for which progress over time has been estimated.
Well, economic growth has a large role to play in terms of reduction in poverty. But the social security systems are also important because miseries and misfortunes could fall on any family. So if you look at the causes of poverty, one is being born in poverty is a good indicator of whether you continue in poverty. Then falling sick, getting out of employment. So there is a need to do 2 things together. One is increase economic growth so that the opportunities are better. And the second is to have a good social security system so that for whatever reasons, if some misfortune befalls some family, they have the state to fall back to for these social security system.
Another report by the World Bank's Brookings Institute shows that there are fewer people living in extreme poverty in India today than before. The study, based on the World Poverty Clock, published in the Future Development blog of Brookings Institute in June this year, says India has shared the distinction of being home to the largest number of poor in the world. India is now at the 2nd position with 73 million extremely poor people. That means a little over 5% of the country's total population lives in extreme poverty. With 87 million people in extreme poverty, Nigeria now tops that list. As per the report, about 44 Indians come out of extreme poverty every minute. At this rate, India is likely to fall to 3rd position by the end of this year. The Brookings study also asserts that by 2022, less than 3% Indians will fall in the category of extremely poor, and extreme poverty could be eliminated altogether by 2030.
So there are, large number of socio-cultural issues. Poverty, of course, is one of the factors, but I don't see that really is the only factor. And in any case, the government have multiple schemes to address access to food. For instance, public distribution system. And you know that in public distribution system, we give 35 kgs of rice or wheat to families. That should be reasonably good, and they have their own sources of income as well. Then we have the whole ICDS system and the midday meal system where we feed the children at least one meal. So that is a supplementary nutrition, as we call it. So it is not only poverty, it is a poverty of ideas, it's a poverty of information, it's a poverty of the thinking processes. It is also a lack of awareness.
However, India still has a long way to go in nutrition and health. As per the United Nations State of Food Security and Nutrition in the World report for 2018, 38.4% Indian children under the age of 5 are affected by stunting. Prevalence of stunting varies between poor, middle and rich households. Stunting rate for children under 5 belonging to the poorest households is 50%. India has registered good progress towards reducing the number of overweight children under 5 years old. According to the latest National Family Health Survey 4 for 2015-2016, a third of women of reproductive age between 15 and 49 years of age are undernourished with a body mass index or BMI of less than 18.5 kg per meter square, and 51.4% women of reproductive age are anemic. To free India from malnutrition, the Union government has set up the National Nutrition Mission or Poshan Abhiyan to monitor and ensure holistic development and adequate nutrition for pregnant women, mothers and children.
You will be aware of the aspirational districts program where we are focusing, and even in the Poshan Abhiyan, the sequencing of the districts to be taken up for under Poshan Abhiyan is in the decreasing order of malnutrition. So the highest burden district will get the priority, and then we go as more and more resources are available, then we go to those districts with lower burden of malnutrition. So we are prioritizing those areas which require more attention.
Implemented by the Ministry of Women and Child Development, the Poshan Abhiyan aims to reduce stunting, undernutrition and anemia among young children, women and adolescent girls and reduce low birth weight. With inputs from Astha Kulshresht, Bureau Report for Rajya Sabha TV.
Healthcare has become one of India's largest sectors, both in terms of revenue and employment. Healthcare comprises hospitals, medical devices, clinical trials, outsourcing, telemedicine, medical tourism, health insurance and medical equipment. The Indian healthcare sector is growing at a brisk pace due to its strengthening coverage, services and increasing expenditure by public as well as private players.
India recently achieved a major milestone in reducing child deaths. The country's under 5 mortality rate for the first time was estimated at 39 deaths per 1,000 live births, which is the same as the global average. The under 5 mortality of the girl child is 2.5% higher than the under 5 mortality rate of the boy child. However, this gender gap has reduced significantly, given that the difference was nearly 10% in 2012. It is one prominent example of the gains healthcare has made in the country. Healthcare is also one of India's largest sectors in terms of revenue and employment. During 2008 to 2022, the market is expected to record a compound annual growth rate of 16.28%. In dollar terms, the total industry size is expected to touch $372 billion by 2022. Indian companies are entering into merger and acquisitions with domestic and foreign companies to drive growth and gain new markets. The hospital industry in India stood at 4 trillion rupees in 2017 and is expected to increase at 16 to 17% to reach 8.6 trillion rupees by 2023. With its focus on assuring healthcare assistance to all Indians and reducing out-of-pocket spending on healthcare, in the last 4 years in power, Prime Minister Narendra Modi's government has also introduced various high-priority reforms in the health sector. The most important initiative in this direction, of course, is the recent Ayushman Bharat scheme. This world's biggest government-sponsored healthcare scheme has been renamed as PM Jan Arogya Yojana. It became operational from September 25th on the birth anniversary of Pandit Deen Dayal Upadhyay. Ayushman Bharat aims to provide healthcare facilities to over 10 crore families, covering urban and rural poor. The scheme has a defined benefit cover of 5 lakh rupees per family per year for secondary and tertiary care hospitalization. It offers a benefit cover of 5 lakh rupees per family per year. The intended beneficiaries are poor, deprived rural families and occupational category of urban workers' families. To ensure that nobody is left out, especially women, children and the elderly, the scheme has no cap on the family size and age. It is also cashless and paperless at public hospitals and empaneled private hospitals. Other government schemes and initiatives are Pradhan Mantri Surakshit Matritva Abhiyan, that is aimed at reducing maternal and infant mortality rates through safe pregnancies and safe deliveries. Mother's Absolute Affection, a nationwide program to bring undiluted focus on promotion of breastfeeding and provision of counseling services for the same. Introduction of new vaccines like rotavirus vaccine, adult Japanese encephalitis vaccine. Mission Indradhanush, Family Planning, the National Deworming Day, a flagship initiative of the Ministry of Health and Family Welfare, was observed on 10th February 2016. Pradhan Mantri National Dialysis Program, National Program for Control of Blindness, National Program for Healthcare of the Elderly. Health sector in India is characterized by several challenges like high out-of-pocket expenditure, low financial protection and abysmally low health insurance coverage. It is estimated that 62.58% of the country's population has to pay for their own health and hospitalization expenses. According to a recently published research paper based on cross-sectional analysis of National Sample Survey Office data, 55 million Indians are pushed into poverty in a single year because of having to fund their own health care, and of this, 38 million fell below the poverty line due to spending on medicines alone. In such a scenario, government's consistent efforts to make health facilities affordable and accessible has come as a ray of hope to millions of people. Bureau Report, Rajya Sabha TV.
Rural India is fast catching up with urban India thanks to the relentless initiatives of the government. One of these is the Swachh Bharat mission, under which the government is aiming to make India defecation-free by the year 2019. Since its launch 4 years ago, the program has made tremendous progress.
With an aim to accelerate the coverage of universal sanitation in the country, the government launched the Swachh Bharat mission in 2014. The nationwide campaign, which will end in 2019, has two subsets: the Swachh Bharat Abhiyan Grameen and the Swachh Bharat Abhiyan Urban. Through the mission, the government aims to clean up streets, roads and infrastructure of cities, small towns and rural areas. It aims to achieve a clean and open defecation-free India by next year through its Swachh Bharat Mission Grameen. In rural India, this would mean improving cleanliness through solid and liquid waste management activities and making villages open defecation-free, clean and sanitized. The program is on track to achieve many of the objectives that it had set out with. According to the 2011 census, before 2014, over 67% of the rural population defecated in the open. In 2014, when the mission was launched, around 11 crore households had no toilets. Since October 2014, when the program was launched, the Swachh Bharat Mission Rural has equipped 8 crore 68 lakh 97,244 households with toilets. This number was just 48 lakh 95,941 before that. The number of open defecation-free villages has gone up from 27,026 to 5,08,786 over the same period. Currently, 529 districts are open defecation-free in 25 ODF states and union territories.
No, actually now we see urban areas, by and large, they have covered. Maybe some 10% something it to be covered. And rural areas, 93%. So it is doing very well, and in the last 4 years, good progress. So I hope it will do something more.
Other objectives of the mission were to motivate communities to adopt sustainable sanitation practices and facilities by creating awareness and health education. and to encourage cost-effective technologies for ecologically safe and sustainable sanitation. As part of the campaign, volunteers known as Swachhagrahis promoted indoor plumbing and community approaches to sanitation at the village level. Other government initiatives include interministerial collaboration for the mission. These include the Namami Gange program that plans to make villages on the banks of the Ganga open defecation free. The Swachhata Action Plan is a separate budget head created by all ministries. In the financial year 2017-2018, 77 ministries committed funds worth 12,468.62 crore rupees for their Swachhata Action Plans. Swachh Swasth Sarvatra is a joint initiative between the Ministries of Water and Sanitation and Health, and the Swachh Iconic Places is a multi-stakeholder initiative focusing on cleaning up 100 places across India that are iconic due to their heritage, religious or cultural significance.
Challenges are that those toilets are built should be used, should be followed up, maintained, and also if you have to create new one, because public toilets are not very large in numbers. So like National Highway or they say many places you go, there is no toilet at all. So those areas you have to go and do toilets also. So that way we have a challenge, but certainly India is doing very well in sanitation sector.
In just 4 years, the Swachh Bharat mission has played a big role in making a remarkable transformation in people's lives. A large majority of the country's population lives in rural India, and with the Swachh Bharat mission picking pace, many people, especially women, no longer have to suffer the indignity of having to go out into the open to defecate. It marks a sea change in terms of dignity of daily life. While the mission is moving towards a more or less successful completion, challenges towards achieving full rural sanitation persist. While the government has succeeded in building toilets, a significant number of people still prefer to defecate in the open as a matter of routine. Lack of water and an absence of clean toilets are other major reasons for not using toilets. Bureau Report, Rajya Sabha TV.
And that's it from us in today's edition of In Depth. We'll be back same time on Monday with a focus on some other important subject. You can also watch our episodes online on YouTube and Twitter and get back to us with your feedback and suggestions. Thanks for your time.